Welcome, everyone. We're going to go ahead and get started. Welcome to our training on Moody Teens Basic Parenting Tips for Youth with Depression and Anxiety. This is a very important topic. We know that teens have emotions and feelings, and it can be very difficult as parents to navigate those moods and emotions and those feelings and those ups and downs. So my name is Kimberly Blair. I am the Executive Director at Mid-Ohio Psychological Services. I'm also a licensed professional clinical counselor, supervisor, and a parent of a teen and preteen. So I have come with some experience professionally and personally working with this population. I'd like to thank the Columbus Foundation for sponsoring this parenting series. We have a 4-part parenting series through a grant with the Columbus Foundation. And as part of the grant, we are offering 4 free workshops to parents. And we're recording this one tonight so that others who weren't able to make it tonight, because we know May is a very busy time, that they can enjoy and use it as a reference in the future. And then we'll talk at the end today about the other pieces in the parenting series parts of the grant. So my goal for us as parents today is to learn 5 different strategies or 5 teaching points on how to help your teen with their mood swings when they're experiencing depression and anxiety. And I think it's important to talk about that when we're talking about moody teens, we are talking about those things that could be clinical depression and anxiety, but we're also going to talk about the normal feelings of depression and anxiety and how we have those emotions. So my goal today is for you to come up with those 5 strategies or my 5 teaching points for you and see if at the end of today's discussion that you can identify those 5. So if you're the kind of person that it needs to stay on task and you want to keep notes, see if you can find which one of the strategies are the 5 light bulb moments, things that kind of light up that are good for you to take away. So before we get into these strategies, let's talk about who we're talking about. What we know and what research says, the literature says that 1 in 4 teens experience feelings of depression. And that was the data prior to the COVID-19 pandemic. What we've seen is the rate of anxiety and depression have doubled since then, and that these rates continue to rise as we feel the lingering effects of the pandemic. And then 1 in 5 teenagers or adolescents experience anxiety. In my experience in the professional world, I've worked at 2 pediatric locations, 2 pediatric offices, so primary care offices, as well as in the outpatient world, child welfare world, and in the juvenile justice world. The 3 most common times that I have seen children experience anxiety is around that 3rd grade testing period where they have to do the state reading test, and there's an influx of anxiety. We've moved from 2nd grade where we are learning how to be friends and starting to learn the academics and starting to get into the routine, to 3rd grade becomes very serious about the content, and that there is a lot of conversation and focus on passing the 3rd grade reading test. And then I've seen this, and this is just my research and lived experience in being in the professional world. The next most common time that I've seen children experience depression and anxiety is in that 8th grade time period. That transition where starting to go through that process of puberty and adolescence, and the hormones are changing, and then we have to prepare for this 8th grade DC trip as they finish up their middle school years or junior high years before moving on to high school. And so I've seen an influx of anxious and feelings and depression during this time period. And then the last time that I see the most common times, now anxiety and depression can happen at any time, their childhood or adolescence. But the most common times that I have seen is with the academic and school performance in high school. And as we are getting into that sophomore, junior, senior year and preparing what's next, and part of that emancipation process of give and take, and wanting to be connected with family, but also knowing I need to take some steps to autonomy and independence. And so those are the three most common times that I see the children experience these feelings of depression and anxiety. So let's talk about what our adolescents have to experience, or what they have to go through initially in this stage. There's a developmental task that states that we need to identify where we fit in. And so as our teens are facing all the messages and the peer influences and the parental influences and the teacher influences, and maybe the coach and their band instructor, their dance instructor, all these messages of where am I? Where do I fit in? What's my identity? And that really starts in the middle school years. And then as they navigate up through high school and into early adulthood, they're really trying to find out who they are. So they might try things on for size. They might go through different phases. They might go through different friends. They might go through different interests or sports or activities as they're trying to figure out where they belong and what their beliefs and values are. And when we're going through that phase, it can be a lot of things coming at us with a lot of expectations. And so the developmental task that they have to face in this stage is, where do I fit in? What do I want to be? And then you can see this image really picks up in the fact that you've got all the peer influences telling this adolescent that they should be something. And so it is not uncommon for our children or adolescents, teens, to feel very lost in this area, which then makes us a little bit more prone to feelings of depression and anxiety if we're not able to go through that development task with the support of loved ones and our peers around us. So as parents, one of the first pieces that we need to kind of focus on is, where are they developmentally? What should they be doing? What's healthy development for them? What are the questions that they should be asking? What are the steps they need to be going through? What are the stages they need to be going through? And if you have a teen that's struggling with figuring out their identity, they start one activity or sport and then they stop and they would try something else new, and you have to juggle all that around. Normalize that is okay. That's what they need to be doing. They need to be trying things on for size. So the next thing is, we need to focus on what is healthy for our teens at this age. And we need to know what they need. And what teens need at this age is, they need to feel safe. They need to find security. They need to love and belonging. And they need to feel that from both their family and their friends. So they need to find it in all places. And this can be a very difficult stage for our teens, because adolescence is not always safe. That they worry about, especially when we're trying to figure out identity, worry about, where do I fit in? And how can I be my authentic self with around my peers, when that image is very common of people telling us what to do? So as parents, we need to be able to help establish that safety, security, love, and belonging, and helping them find their belonging and trying things on for size and helping them figure out who they are and who they want to be is the next important step. As parents, is, what do our kids need in this stage, and how can they help them find safety, security, love, and belonging? And this tug of back and forth as parents, and this tension that we experience as parents is like, how do I keep them safe when they're learning to drive? How do I make sure that they're making safe choices, making healthy romantic or dating relationship choices? How do I make sure that they're safe on the internet? How do I make sure they're safe at school? And so it's this tug of war that we face as parents because we know that we can't protect them from everything. And we need to allow them to make mistakes and figure out what safety and belonging and security and love feels like on their own and get those needs met. But our job is not to abandon them. Our job is not to overprotect, but also not abandon them and make them just, kick them out of the nest, do it your own, figure it out yourself, tough love. Our job is to have that tension of a give and take back and forth with our teens. So we've kind of talked about the two main things that adolescents go through at the stage. They have this identity and where do I belong and who am I and where do I fit in? And then also what do I need? And that safety, security, love, and belonging are their needs. So moving on, let's focus on what is the difference between depression and an anxiety. And I think that it's very common that we use depression and anxiety in this everyday language. And there is a clear difference between clinical depression and clinical anxiety, and then having feelings of depression and anxiety. But when we're talking about the clinical pieces, the clinical symptoms of depression and anxiety, these are signs and symptoms that could be related to another condition, such as trauma or some medical complications. But in general, depression is feelings of low or sad mood, often crying episodes, irritability and anger, feeling worthlessness, helplessness, hopelessness, eating or sleeping disturbance, decreased energy, activity levels of feeling of fatigue or tiredness, decreased concentration, interest, or motivation, social withdrawal or avoidance, negative thinking, and thoughts of death or suicide. So keep in mind, that's a very long laundry list of symptoms or signs of depression. And in order for your teen to have clinical depression, they don't have to check off everything off the list. And you actually don't want them to check off everything off the list, right? We don't want them to experience a severe major depression. So they may have one or two of those pieces. And so they might not meet the diagnostic criteria for depression. So it's important to keep that list in the back of our mind. And then the other piece to keep in the back of my mind is, does it impact in more than one environment? So are they experiencing that outside of school? So is it just school, or is it school and home? Is it school and work? Is it school and friends? Or is it family and friends? Where are they experiencing that? And are they experiencing those symptoms for longer than a 2-week time period? And then if we are experiencing them longer than 2-week time period, then we will want to see them with a mental health professional so that we can determine the next steps. Where can we help our kids in the best environment? So moving very similar to anxiety, the anxiety symptoms and signs are feelings of apprehension or dread, feelings of tense or jumpiness, feelings of imperfection, mistake, or disappointment, having a freeze response, feeling poor performance in games, poor concentration, restlessness or irritability, anticipating the worst or being watchful of signs of danger, pounding or racing heart, shortness of breath, sweating, tremors or twitches, headaches, fatigue, insomnia, or upset stomach, frequent urination, and diarrhea. So again, a very long list, and the anxiety list is a little bit longer than the depression list. And keep in mind, we want to make sure that when we're looking at clinical depression or clinical anxiety, we're looking at it that does it happen in more than one environment, and does it happen for more than a 2-week time period? And this, we could experience some of these pieces because of the things that go on with our life. We struggled with maybe in a certain course or a class, we're not passing that class, or we didn't make the football team, or we recently had a breakup with a significant other. Those are some things that may happen that you're like, oh yeah, that checks off. But then did it consistently check off? Did your teen consistently have that for over a 2-week time period? Again, so if your teen is experiencing this for more than a 2-week time period and is in multiple environments, then you'll want to call a mental health professional. Now, I'm also going to say that even if they don't have a lot of the symptoms and you're kind of questioning it, still call that mental health professional. Let somebody walk you through those steps so that you're not alone, because it can be very isolating as a parent, especially a parent who is trying to care for their child, who is experiencing these moods and emotions and feelings. So it's also very difficult to determine when we look at these symptoms and signs lists that may be related to trauma, ADHD, as I said earlier, medical pieces. There's a lot of overlap between depression and anxiety as well. What we know is that untreated anxiety has a higher risk for resulting in depression. So, one of the first signs that we see with anxiety or depression, and especially in high performing teens, is their physical complaints. It is the stomach aches, it's the jitteriness, it is the headache. And so, those are some good warning signs for you that maybe your kid is experiencing some emotions or some moods that may be difficult for them to talk about. Because remember, we're coming back to they have that need of safety and security. And they also know that the tension is they're supposed to talk about with their parents about some things, but not everything. And is it safe to talk about them? Is my parent going to flip out? Am I going to get in trouble? And so keep in mind, you want to be aware of all the signs and symptoms. And maybe the physical complaint is your kind of red flag or yellow flag to say, something may be going on. They don't feel like they can talk to me about it, but I notice that they're experiencing these pieces. So keep in mind of those pieces. If you start to see those physical complaints, then I would encourage you to go consult with your pediatrician, let them rule out any medical problems, and then you can bring them to a mental health professional, or your medical provider can refer you to a mental health professional. So, what we know best practice when we're dealing with teens who experience clinical depression or clinical anxiety is that as a combination pack. It needs the behavioral intervention and medicine to best treat most of the symptoms and signs. So, what we're looking at in this combo pack is that the therapist or the clinical provider, the counselor, that works together with the medical provider. And so it is really important for you to go to your pediatrician, your medical provider first, screen out any medical problems, see if they can help out, and then start the behavioral treatment or the counseling. And, there's different combinations. There could be family therapy, there could be individual therapy, there could be a combination of both, there could be treatment within the school. But what we know is that the successful treatment for this population is a combination of medication and therapy. And the most effective therapy that has the best short-term outcomes and the long-term outcomes is medication in a combination with what we call cognitive behavioral therapy. And what cognitive behavioral therapy, or sometimes called CBT, is it works on understanding our thoughts and our feelings and how they're connected to our behaviors and our actions. So working together on what our behavior and what we're thinking, as well as taking the edge off of those deep feelings, those difficult feelings and emotions with the medication. So we've talked about clinical depression and clinical anxiety, and we've talked about the signs and symptoms. And the first piece, my first tip for you as parents is to find out what's normal, identify the normal piece. We know that teens have intense emotions. They're going through so much. It's a very difficult life stage. And what we want them to experience is that safety, security, love, and belonging, and finding their identity. And because of all those pressures, we have these intense emotions. We know that the hormones are impacting. We know that they can go from 0 to 100 really quickly. They can go from happy to sad really quickly, and that is expected. And so what we need to do is make their emotions make sense to them and to us. And so painful feelings are part of life. Emotional pain is part of being human. And so our job as parents is not to take that away from them. It's not to protect them from that. So helping normalize that, yeah, it's okay to feel sad at times, or yes, it's okay to feel anxious when you're going through a new experience. And normalizing that we all have mood swings. And then determining, are those mood swings really impacting the daily activity? So are you starting to see school refusal? Are the grades dropping or changing? Are you starting to see them isolate and maybe not interact with family and friends? Do you see a lack of interest? So normalizing that we have emotions, labeling it, helping our kids label, saying, yes, I'm feeling sad, or yes, I'm feeling anxious, and normalizing that's okay. And I think as parents, it's hard for us also not to float into like, oh yeah, I felt like that when I was your age, or yes, I feel like that yesterday. There's a balance of normalizing it, but then not making the story about us. And as parents, we need to let them tell us. We need to listen. So saying, yeah, normal, it's expected. I expect that it's okay to feel sad when you get rejected, or you don't make the football team, or you had a hard test, or you're preparing for a midterm and you feel anxious. Tell me what's going to make you feel better. What can I help with? Where can I listen? What do you need from me? Instead of being like, well, this is what I did back in my day. When we get into more of the listening stage and normalizing it, that really is powerful for our children, because what we're doing is we're saying, I'm safe. You're safe here. You're secure here. I love and I love you no matter what, and you belong here no matter what. So normalizing is my first tip for you. My first light bulb. The second piece is really to understand what the function of anxiety and what the function of depression is. And if we can identify and be friends with our anxiety and be friends with our depression, and those pieces, then we're more likely to be able to make change faster. So the function of our anxiety is to protect our fear. And so if we normalize that our anxiety is to protect things that make us worried, or things that are a threat to us, that's okay, right? So if I worry about preparing for a test, and I worry that I'm going to fail this midterm, and then I am worried that I'm going to fail the course, and I'm going to have to do summer school, and then I'm not going to have a job, and blah, blah, blah. And I think you can know where I'm going at. What we can do is say, what is my anxiety telling me right now? What is my worry telling me right now? Well, my worry is telling me that I really want to do well, and it's protecting me from failure. So how can I flip the script so that I'm not worried about failure? Like, I can even embrace that piece. So you know what? It's not the worst thing that happen if I don't do as well as the test, but I know I can do well on the test. What happens is, if we continue to feed that anxiety monster, then we will continue to make it worse. And so one of the ways we feed our anxiety is we avoid. So I'll tell a story. Is my son was going through a new school. He got redistricted, so it was unexpected. And he was really struggling with just the adjustment of the unexpected. He's going through middle school, so right, like middle school is hard. And then being redistricted on top of that makes it a little bit harder, and was navigating a new soccer team and new friends and new school. And so a lot of new things. And he kept on asking to be picked up earlier, asking to stay home, or asking just not to go to school. And it became a struggle, because as a parent, I wanted to protect him. I wanted to keep him safe. I didn't want him to experience all the yucky feelings that go along with something new. But I knew that if I took those things away, those really critical, important moments for him to build his skills internally, then I would struggle, that I would enable his struggle. So I would make it worse. So one of the pieces that we did is we talked about the importance of him going, and then how can we empower our anxious feelings and our worry, and so that we can build on it, so we can be really friends with it and using it as a superpower instead of using it as a weakness. And what we know is if we use avoidance, then it makes things worse. um, it's really hard as a parent to experience your child worrying about those pieces, and that seeing your child being fearful. But we know that our parenting strategy is that we need to understand the function of our behavior and not feed into the avoidance cycle, that we can empower them to make choices for themselves, empower them to face their fears, and empower them to understand the reason we experience anxiety. So the next piece is understanding the function of our depression. So it's common in teens to experience depression. You see irritability, you see inability to tolerate stress or adversity, and depression can make it really hard for teens to get along with their families and friends. Usually, when teens experience depression, they often isolate themselves, they lose interest in activities and enjoy. And so, depression is usually things worrying about the past or helping us heal from our pain. It's usually a way for us to heal from illness or injury or adapt to a loss. So if we think about anxiety is worrying about the future and depression is worrying about the past, helping our children stay present in the moment and using those pieces, the healing, the things that have happened to us as superpowers and strengths, and the things that we worry about as superpowers and strengths, then we can become friends with our depression and our anxiety. So identifying what the function is of our depression and anxiety, and then helping that embrace and empowering them. And I think also, we started talking about normalizing emotions and these intense emotions teens face, and then normalizing our human response to life stress, that it's okay to have these feelings. So, moving on to the next piece, what happens when we experience depression and anxiety is we get on this hamster wheel, this hopelessness and helplessness cycle that I didn't make the basketball team, so I'm not going to be able to play basketball, so I won't be able to go to college, and I won't be able to make friends, and all these pieces in this constant cycle that continues to repeat. And one of the goals as parents, but also one of the goals in therapy, is to help stop that cycle of hopelessness and helplessness, that helping identify what our negative thoughts are and impact our feelings, that impact our behaviors, and identifying when we experience those very negative thoughts, those feelings of hopelessness and helplessness. Um, and then stopping the wheel and coming up with some coping strategies, coming up with some safety plans, coming up some practices, even signs as parents is like, stop, freeze. Let's think about, are you on the hopeless and helpless wheel? What is your hamster doing right now? If you can do some of those pieces as a parent, helping them cue those negative thoughts, and then how that impacts their feelings and behaviors, really helps the teen take the next steps. You want them to start to recognize when they've got on the wheel and how they get themselves off of it. Again, back to what our kids need. They need to feel safe and secure, but they don't need us as parents to do it for them. And so they need to find their safety and security to stop that hamster wheel from continuing to cycle. So number two tip is to stop that hopeless and helpless cycle. Some other ways that we can stop those cycles and change our mind, our thoughts, is helping our teens understand what are the things that they can control and what are the things that are outside of their control. So they can control their own self-care, they can control their priorities, they can control their knowledge and skill, they control how they respond, they can control their goals, their attitude, their boundaries. how they treat others, their actions, reactions, and mindset. And notice all those words are my and I. And so these are the things that we can control. We can't control how our best friend responds. We can't control when something happens negative at school. We can't control how our sibling reacts. We can't control if we got the job or not, but we can control our thoughts. We can control how we respond. So thinking about in your life as a parent, what are some things that you can control and what are some things that you can't control? And then what's in your circle of control and what's outside of your circle of control? And even just cueing in your own mind of like, yep, that's outside my circle of control. So, your teen not making a sports team or not being first chair in band or orchestra, not in your control, right? But you can control how you support your teen, how you show them that it's okay and that you love them no matter what and that they belong, and then you'll help them find their place and belonging with their peers. And then the next piece, when we're talking about how changing our thoughts and our cognitive strategies, is understanding what the difference between a growth mindset and a fixed mindset. And this was a really popular topic, and I was really pleased a couple of years ago when my elementary child at the time came home and said, "Hey, Mom, I learned about growth mindset and fixed mindset." And I was like, "Oh, wow, that's incredible. I'm so glad because I think some adults need to learn it as well." But the fixed mindset is the things that is fixed, that I can't do that. I'm not good enough. I don't like to be challenged. I am frustrated and I'm going to give up. I won't make the team. And then a growth mindset is I'm not ready yet. And that's always really nice to put that yet at the piece. I'm learning and growing, but I'm not ready yet. I like to try new things and I'm going to try new things. Or I didn't make the first chair, but I'm going to try harder and I'm going to work harder. I learn what I have control of what I learn. I can have the opportunity to grow, or what is this teaching me? And so this challenge is not ready for me. So I'm going to go on to the next challenge. So think about times in your life, even as a parent or in your day-to-day life, times that have come up that say, you know what, that's a fixed mindset, or and how can you flip the script to something that is a growth mindset? As parents, we want to cue helping our children write these internal scripts to change their mindset. And, what I have found with my kids is that by teaching them the growth mindset and fixed mindset, and also them learning at school, they help me stay accountable to be like, Mom, that was not a growth mindset. So if I say, I just do not make good lasagna, which is not true. I think I make pretty good lasagna, but that was on my mind. Um, they will say, no, Mom, I think that you could still this lasagna wasn't that good this time, but I still think that you could do it next time, or this was not the best, but we can do it. I can work together with you in making the lasagna. And so that we turn it into that growth mindset. So think about times where you can help cue your child to flip the script from a fixed mindset to a growth mindset. And then even teaching that concept working together can help your teen and you work together and embracing those pieces. So changing our thoughts was the next piece. And then the next piece is changing the patterns. Well, we know about children nowadays, and there is some new, I just saw the announcement, some new legislation out there about all the technology our children are exposed to and pieces. They get so many messages. They are getting notifications and constant messages. And one of the pieces that we have found about children who spend time outside and change the pattern and disconnect from technology is that they are having better overall mental health. Now, I am here to tell you that I probably can say both of my children are in technology right this minute. So I'm not here to tell you no technology at all. I think everything in moderation, but knowing what your children, how much they're exposed to technology, and then if you start to experience seeing those signs of depression and anxiety, see what happens when you back off technology, taking a little bit away and seeing if it changes. I call it when my son stops playing video games for an unaccounted amount of time. I don't know. He comes out as a zombie. And so we kind of say like video game zombie. I see the emotions more intense. He's more irritated and more irritable and more angst. And so we talk about those pieces. I'm like, just go outside. You need to go outside and hug a tree. But what we know is actually changing the pattern and our children spending more time in natural areas, outdoor environments, actually reduces a healthcare cost that is associated with poor mental health. There are studies that show that nature-based activities for our children have greater benefits than the benefit of exercise alone. So changing the pattern, changing the environment, helping your children find something that's larger than themselves. Is part of one of the developmental tasks in this age is not only their identity, but finding their purpose in life and finding things that starting to being realized that things are bigger than them. I know that's a hard concept for them at that age, but bigger than them. And so putting them into nature helps with those pieces. So changing the pattern and then also changing the amount of messages that our children have. There is a higher emotional challenges with children who spend more time on social media. And so one of the pieces that I think it's important is looking at how many messages our children experience or adolescents experience. It's highly correlated that children with higher levels of anxiety and depression actually spend more time on social media. And again, I'm not here to harp on social media. Both of my children have social media. I tell this funny story that my pediatrician asked my son, do you watch TikTok? Do you have TikTok and Snapchat? And he said yes. And she looks at me and she knows my profession. And I said, tell her how much you have. And he has 1 minute. He has 1 minute on TikTok and Snapchat. So yes, he has the permission, but he uses that 1 minute very wisely. And she just laughed and said to him, like, well, I bet you are very selective on what you do on that. So keeping that in terms of managing our children's messages, I think about, what my children get and how many apps they are exposed to. And there's an app for after school sports. There's an app for club sports. There's an app for his grades. There's an app for interacting with his friends. And there's an app for schoolwork. And I think about it as like I could probably name 10 apps that my child interacts with on an everyday basis. Some of those are related to academics. Some of those are related to sports and activities and clubs. And then some of those are for social pieces. And so I think that we have to be mindful of all those constant notifications and what does that do to the brain with our dopamine and our adrenaline constantly getting a buzz because we have so many notifications. And I remember when my child first started getting his grades updated, he would become obsessed over when are my grades being updated and checking and checking and checking. And I think, well, back in my day, now again, I did not tell him back in my day, but you didn't know what your grades were until the report cards came out 3 months later. And just the constant messaging and constant communications of where we are and where we rank and what do we need to do. And so I think it's important for us as parents to keep in mind of what that is doing to our child's brain and that being mindful of the language we have around the messages and how our child is getting communicated with. I think that also, I was meant to say in the slide before this, but I read this recent study that um, i- inmates spend more time outside than our children do, our adolescents do on a daily basis. And I think about those pieces is that our children have a ton of privileges and not the same privileges that those who are in the jail or the prison system, and they have more privileges of being outside than our children naturally play in their play areas. There's correlation that indicate that when there is screen time and parameters on screen time, it actually decreases symptoms and severity of depression and anxiety. So just being mindful of that pieces. We also know that children's sleep is better when we monitor the messages and the social media pieces that our children experience. So the other piece, and this comes from this polyvagal theory of what our children experience on this roller coaster of emotions. And you can see where the growth and fixed mindset also interplay with these pieces. But what happens is we have this baseline here in our social engagement, and we experience joy, presence, groundedness, curiosity, openness, compassion, and mindfulness as we feel safe and connected, right? So one of our number one needs in this time and developmental tasks is to feel that belonging, connectedness, love, safety, and security. And so when we're in this area, this green area, we're in that I may, I can, right? We're using that growth mindset, and our children experience better digestion, better sleep, decrease in defensive responsiveness, better ways of responding to our peers and stress. But then when we start to have that arousal and our stress response starts to take over, we move into this fight or flight stage, and where that panic and that fear, the rage and anger kind of take over. And so we start this roller coaster pieces. And then we move from the I can into I should, I must, I can't, into that freeze state. And what we know is this is where the depression and anxiety start to happen. And when we experience stress, we move up on our roller coaster, and our body starts to take over, and we move into that freeze state. Our heart rate goes higher, our blood pressure goes up, our facial expressions get more tense, or we start to isolate, disconnect. Our eye contact may lower, or we avoid eye contact. And what happens is our body is trying to keep ourselves safe. So we get into that freeze piece so that our body is taking over and saying, I'm protecting you. And that's where we start to feel that shame, that hopelessness, that feeling trapped and helplessness. And so when we feel anxiety and depression, we get into that freeze state. And in order to get us down to deactivation, by using some of that groundfulness, being mindful of where our body is, being mindful of where our thoughts are, being mindful of our breath, that helps us bring us back down into that ventral vagal area. And so as parents, we can start to map these things out, and knowing where our child is and that I can't, I must, I should, I can, I may, and where they can, how we can help bring them down. So think of a time in your life that you may have started in the I may, I can, and then there was a stress response because maybe you were confronted at work, or you got an email, or you had a big project that was due, or you had to run your kid from one activity to the next, or you were feeling maybe a loss. When you moved and shift from, okay, I'm really at, good, I'm balancing, I got this, my roller coaster's on track, to when my roller coaster started to peak and then come off track. And so I moved into that kind of freeze state piece. So think about it, take a few seconds to think about times where you were on that roller coaster, and then maybe times that your child was on that roller coaster. And then we'll move into how you can help. So one of the two pieces, the two strategies that I really like in any type of activity, but they're really good grounding activities, are what I call is the power of five. And then so we're going to do the five senses and then the five breathing pieces. So when we talk about the five senses, this is something you can do anywhere. You as parents can do it. You can do it at work. You can teach your child to do it. It's a great grounding activity to bring you to that green area, to that I can, I may, away from the freeze state. And these are these strategies absolutely work. So let's think about it. Maybe you close your eyes and start to kind of be aware of your surroundings. And then think about five things you could see, maybe five things you could see before you close your eyes. And naming them and noticing them. And then think about four things you can touch. And sometimes when we get into the touch, we think about touching with our fingers. But I want you to think about where other things are touching. So where are your toes touching, your feet, your heels? Maybe your legs are touching something. Maybe they're touching each other. Maybe you can even feel like your pant legs touching. Where's your belly touching, your shoulders? Maybe even feeling your hair, your mouth or your lips touching. And noticing things that are touching beyond your fingers. So four things you can touch. And then what are three things you can hear? Maybe you can hear something outside, birds chirping, a fan blowing, my voice, the motor in your computer or your phone. There are three things you can hear. And then what are two things you can smell? This is where I usually get giggles. So what are two things you can smell? Noticing, bringing your awareness to that sense that we don't usually tap into unless it shocks us in the face. And that's one thing you can taste. Maybe it's that last sip of water you took or dinner, or one thing you can taste. And then bringing your awareness back to the space, back to the place, and notice what it feels like. Notice how spending 30 seconds on your five senses that you probably didn't spend at all today, noticing how maybe it lowered your heart rate. Maybe you have a little bit of a clearer mind. And then if it did neither of those things, that's okay because it doesn't work for everyone. So five senses, five things you can see, four things you can touch, three things you can hear, two things you can smell, and one thing you can taste. The other five activity, the power of five, is a five-finger breathing. And most kids actually know this because they teach it in school, but I think as adults, it's really helpful. So if you are at the place where you feel like you're going to lose it or you're feeling intense emotions, using the five-finger breathing can really help ground you and keep you back into your place so that you're not emotionally reacting to your child. So what I like to do is I start at the opposite of the palm of my finger, and on the in-breath, I lift up, and then I bring my finger down to the pinky, and the out-breath, I let out. Inhale, fill up, tracing the ring finger. Out, I release. Inhale, fill up. Exhale, release. Inhale, up. Exhale all the way down, making that exhale really long. Inhale, fill. Exhale, release down the palm. And what's really nice about this is you can do this breathing at any time. So maybe it's at work, or maybe it's when your teen comes home late, and just using this grounding piece brings us down off the roller coaster, down off that peak, bringing our roller coaster back on track. And no one has to know we're doing it. We can do it on our pant leg, in our pocket. We can just trace it, closing our eyes, maybe even hiding in the bathroom is a great place to do it. And then the other piece is, I think it's really important for parents to focus on your self-care. It can be really exhausting working with your teens, your adolescents, let alone when they're experiencing those difficult and intense emotions and those extreme emotions and feeling depression and anxiety that may also trigger feelings for you. And so it's important to take care of yourself, check in with your support system, find the place where you feel you belong and that you can find that love and safety. I think there's a lot of blame and stigma associated with parents and parenting of adolescents. And we know it takes consistency, and sometimes it doesn't fill our cup. It's not why we got into it to have our kid yell at us or have these extreme emotions or test the boundaries. And so, coming back to your self care strategies. So, as we wrap up, our first step is to normalize it. The second piece is to recognize our function. The third piece is to stop the hamster wheel, understand what's in our circle of control and where our mindset is. The fourth is to change the pattern. And the fifth is to be mindful of our body and our breath, the power of five. And what I went over today is just likely the tip of the iceberg. If you bring your child to therapy, there's going to be a lot more things that they're going to explore below the surface. I give you some 5 simple things that you can work on to kind of create a Band-Aid until you can get into care if that is the path you need. Some of the things that we didn't talk about today and some additional topics that parents need support is understanding when their child experiences self-harm or uses self-harm, identifying how to manage suicidal ideation and thoughts and attempts, and then balancing through parenting with school refusal. And some of those pieces we'll be covering in further trainings and the on-demand courses, and then we have tip sheets. But feel free to reach out to the agency or myself. You can reach out at info@mopsohio.com, or my email is kimberlyblair@mopsohio.com, and I can definitely provide you further resources on these pieces. The 2 pieces I often get asked, what are my 2 recommendations, and 2 things that I really like for this age is the book called Superpower, Transform Anxiety into Courage, Confidence, and Resilience. It's written for teens, for teens. It's great. I have parents that I work with read it, and also their teens read it. It's in most libraries. It's pretty affordable on Amazon. And then The Emotional Lives of Teenagers by Lisa D'Amour. Dr. D'Amour does an amazing job of understanding normal emotions for children and then knowing when those are maybe high risk or areas where we need to further get help for our children. So I think it's a great book. It's a pretty quick read. It is also, I've listened to it, and it's a pretty fast listen as well. And then lastly, if you go to mopsohio.com parent series, you'll see that we have a lot of parenting education resources that are part of the Columbus Foundation grant. This is one of those virtual parent workshops. We have 3 more virtual parent workshops. We are hosting a parenting pep talk every month where it's about 15 minutes of just kind of like a quick podcast on parenting strategies and tools. We have an on-demand resource library. I think there's 9 resources right now. Our goal is to get up to 25 resources on that website. So they're quick tip sheets that parents can print off, that you can put on the fridge, that can be very helpful. And then we will have, I think, 10 on-demand courses where parents can access on-demand, taking the course on your phone, taking the course on a computer, you're sitting at soccer practice and you can take it on the sidelines. But they're really easy to use coursework, and they usually are taking about 20 to 30 minutes that are accessible. So All of those links are on our website, or you could use that QR code to access those pieces. They're all free for parents, so please spread the word. We want as many parents to use these as possible. One of the reasons we designed it this way is we wanted to have quick, accessible care for parents and resources for parents that were free and fast. And so, as you're on the go, as we know, using these strategies to help you. And then lastly, this is the contact information. You can go to our website. That's my contact information to get more information, or if you need a referral for mental health, feel free to reach out. And that concludes our first parenting workshop training. Thank you, everyone, for participating. And feel free to check us out and have a wonderful